Hi everyone! Welcome back to your channel name, where we simplify dental procedures for students and professionals alike. In today's video, I'll walk you through the step-by-step procedure for taking an IOPA X-ray of a single tooth. Let's get started. Intraoral periapical, or IOPA, X-rays are essential for diagnosing dental issues like cavities, root fractures, and infections. Today, we'll focus on capturing a clear X-ray image of a single tooth using an IOPA X-ray machine. We'll cover everything, from equipment setup to processing the image. Don't worry, it's easier than it sounds. First, let's take a look at the tools you'll need. 1. An IOPA X-ray machine. 2. X-ray film or a digital sensor. Choose the size based on the patient. 3. A film holder like this RIN XCP holder for accurate positioning. 4. A lead apron and thyroid collar for patient protection. And finally, either an X-ray viewer or a computer for processing the image. To prepare the patient, ask them to sit upright and wear a lead apron and thyroid collar to minimize radiation exposure. Also, ensure they remove any items like glasses, earrings, or dentures that could obstruct the X-ray. Next, we'll position the film or sensor inside the patient's mouth. Identify the tooth to X-ray. Let's say it's the upper first molar. Select the right film size. For posterior teeth, size 2 is ideal. Place the film horizontally, parallel to the tooth's long axis, with the film holder to stabilize it. For anterior teeth, position the film vertically in the midline of the palate or the floor of the mouth. Always ensure the film covers the entire tooth and its surrounding area. Ask the patient to bite gently on the film holder to keep it stable. Now, let's position the X-ray tube head vertical angulation. For maxillary posterior teeth, set the angle between plus 20 degrees to plus 30 degrees. For mandibular posteriors, use minus 5 degrees to minus 10 degrees. Adjust the angulation based on the tooth's location. Horizontal angulation. Align the beam to pass through the contact points of the teeth to avoid overlap. Finally, center the X-ray beam on the film or sensor. Use the aiming ring of the film holder for precision. Set the exposure time based on the patient's size and the tooth location. For adults, it's typically between 0.2 and 0.4 seconds. Instruct the patient to stay still during the exposure. As the operator, ensure you stand at least 6 feet away or behind a protective barrier. Then, press the exposure button to capture the image. Once the exposure is complete, it's time to process the image. For traditional films, you can develop the film manually or use an automatic processor. Immerse it in the developer, rinse, and then place it in the fixer. Once it's rinsed and dried, hold it up to an X-ray viewer for inspection. For digital sensors, the image will appear instantly on the computer screen. You can use imaging software to adjust contrast or zoom in for better diagnostics. Ensure the X-ray shows the entire tooth, including the crown, root, and surrounding bone structure. Watch out for common errors like cone cutting, elongation, or overlapping contacts. Here are some common errors and tips to fix them. First, cone cutting. Ensure the beam fully covers the film or sensor. Second, elongation. Correct the vertical angulation. It may be too shallow. Third, foreshortening. Reduce the steepness of the vertical angulation. And lastly, blurry images. Ask the patient to remain completely still during exposure. Remember to follow the ALARA principle, as low as reasonably achievable. Always minimize exposure by using protective gear and reducing retakes whenever possible. And that's it. Taking an IOPA X-ray of a single tooth isn't as intimidating as it might seem. With practice and attention to detail, you'll be capturing perfect X-rays in no time. If you found this video helpful, don't forget to like, comment, and subscribe for more dental tips and tutorials. See you in the next video.